How does Rha cause lung disease in your body? Rheumatoid arthritis can affect more than just your joints. It can also cause lung problems through a process driven by your immune system attacking your own lung tissues. This happens because Rha is a systemic autoimmune disease, meaning it can target multiple organs, including the lungs. The immune system mistakenly identifies parts of the lung tissue as threats and triggers inflammation. This inflammation damages the lining of the airways and the tiny air sacs in your lungs called alveoli, which are essential for oxygen exchange. The process often starts with chronic injury to the cells lining the airways and alveoli. Factors like smoking, infections, genetic factors, and changes in the lung environment can make this injury worse. When these cells are damaged, the immune system can become overactive, producing autoantibodies such as anticyclic citrullinated peptide antibodies. These autoantibodies are often present even before joint symptoms appear, indicating that lung involvement can sometimes be an early sign of Rha. Once the immune system is activated in the lungs, immune cells like T cells, B cells, macrophages, and neutrophils releases chemicals that cause ongoing inflammation. This persistent inflammation leads to changes in the lung tissue, including scarring or fibrosis, which makes the lungs stiff and less able to transfer oxygen into the blood. This condition is called interstitial lung disease, and it is a common complication of Rha. It can cause symptoms like shortness of breath, cough, and fatigue. In addition to interstitial lung disease, Rha can cause other lung problems such as airway diseases like bronchiectasis and bronchiolitis, inflammation of the lining around the lungs called pleuritis, rheumatoid nodules in the lungs, pulmonary hypertension, and blood vessel inflammation. Sometimes, lung issues can even appear before joint symptoms, suggesting the lungs might be an initial site where autoimmune activity begins. Environmental factors like smoking and genetic predisposition play a role in lung involvement. Smoking, in particular, damages lung tissue and promotes the production of citrullinated proteins, which are targeted by autoantibodies. Recognizing lung disease early in Rha patients is important because some medications used to treat Rha can affect lung health, and lung complications can worsen overall prognosis. Managing lung disease in Rha involves careful monitoring and tailored treatment plans. Regular screening for lung involvement is recommended, especially for those with risk factors like smoking or positive autoantibodies. Treatment may include medications to control inflammation, but it must be balanced carefully to avoid worsening lung issues. Always consult healthcare professionals for personalized advice, as individual experiences with Rha and lung disease can vary widely. In summary, Rha causes lung disease through an autoimmune process that damages lung tissue, leading to inflammation, scarring, and various lung conditions. This highlights the importance of vigilance and early intervention to maintain lung health alongside managing joint symptoms.